So first we have the cervical compression test, sometimes also denoted as the neutral cervical compression test because it occurs in the neutral position. So from here, we'll have our patient positioned in the neutral position. We'll let them know what they're in for. We're going to place some gentle pressure through your head into your neck. Let me know if this causes you any pain or other symptoms. And the key with all of our compressive tests is to load gradually and release gradually. This is something that I will be looking for because it can have a very jarring and unpleasant effect if the compressive loading is done too quickly, and as well if it is released too quickly. So we want to make sure that we treat our patient gently, and this is one way to do that. So neutral compression or simply cervical compression, first test. What we're looking at here is primarily the opportunity to induce or increase compression due to a space-occupying lesion, typically near the intervertebral foramen, and this is going to give us a radiating pain presentation, which, if confined to a dermatome, is consistent with cervical radiculitis or radiculopathy. So that's kind of the most classic version of the positive for this test. Our patients can also have local mechanical neck pain that is aggravated by this test, and that's something we'd like to take note of as well. So we kind of have the local and the radiating components that we can look at as positives for this test. In addition to pain that radiates, we can also, of course, find other disturbances of sensation like paresthesia, hypoesthesia, anesthesia. So looking at those sensory components, and again, if they are confined to a single dermatome, then our index of suspicion for a cervical radiculitis or radiculopathy is going to be much increased by the results of this test. So, questions on that? Okay. I'd like to show you the next one simply because it's very related. We have Sperling's test, which is just our compression test with some lateral flexion added. So here we are, laterally flexed, slowly compress and then release. Return the patient to neutral, then to the opposite side. Slowly compress and then release. And so what you can likely see from this is that we now have an increased level of compression occurring at the IVF. We've laterally flexed toward the side of involvement or the side that we're testing, and that's going to give us a greater potential to induce compression into that side's IVF. So that's Sperling's test, lateral flexion plus compression, very similar to neutral compression. Same interpretation. Question?
Are you pressing straight down or on the diagonal?
Yes, good question. So your compression in this test is going to be along the axis of the cervical spine. So you're pressing into the cervical spine, but you're doing so in such a way that there's also going to be a little bit of downward force. So that is to say that just by nature of the positioning, we're going to be inducing a little more compressive force onto the right side than the left, but your goal when performing this is to compress straight into the axis of the cervical spine. Good. Any other questions for this one?
Still similar to what he asked, but since the cervical spine is now at the angle, so and you said along the axis, so axis now has changed from completely downwards to being at the angle, right?
Exactly. So the
this
axis
is
of the cervical spine, when the cervical spine is placed into lateral flexion, is still the axis of the cervical spine. It's simply now deviated from the pure y-axis of the body.
got it.
So this way is where your compression goes. This is the pure y-axis of the body.
Yep.
Good. Okay, so let's practice this in our partner pairs. And again, practice applying your compression slowly, releasing it slowly, checking in with your patient. What are any symptoms, if any, that have been reproduced?